Canada's Chief Public Health Officer, Theresa Tam, says that yesterday's cancelled technical briefing regarding possibly new recommendations for the AstraZeneca vaccine had nothing to do with the drug itself.
They received some new data that they thought was pertinent in terms of analyzing the impact of the COVID-19 on the population in light of variants of concern, and not because of any changes in the data already existing for thrombosis disorder itself. That remains a rare disorder.
The National Advisory Committee on Immunization previously recommended that AstraZeneca only be used on people 55 and up due to the extremely low risk of developing a treatable blood clot. Health Canada recommends that the vaccine is safe for people 18 and up. Ontario began jabbing people 40 and over with AstraZeneca yesterday. A record 136,695 doses were administered in just one day.
I believe that people should feel confident.
The doctor's attention was also focused on escalating cases abroad, particularly in India. Nearly 300,000 new cases of COVID-19 were reported today, along with 2,000 more deaths. When asked why Canada hasn't increased restrictions on travel from India, the doctor said while they're keeping an eye on the situation, current measures at airports should work.
That with viruses, it's practically impossible to prevent new variants from arriving here in Canada.
The pre-boarding test, the post-arrival 2 tests, and of course our foundation, which is the 14-day quarantine.
The doctors were also asked about whether restrictions could begin to be lifted once 80% of the population gets at least one vaccine dose. Major General Danny Fontaine, who is overseeing the vaccine distribution, suggested that milestone could be reached. But Dr. Tam says even reaching that milestone with single doses doesn't guarantee the lifting of restrictions.
Getting that second dose is very important to ensure that when we relax measures, you're not back to sort of the beginning of trying to get the virus under control.